conversations begin with questions. Some even begins with fear, uncertainty, and even silence. So everyday cancer helplines becomes a space where everyone try to find comfort, clarity, and even they just need someone to listen to. For today episodes, we are joined by two of our strong and empathetic women who are also from the Cancer Helpline. So before that, I am your host. I'm Atika, and I'm from Cancer Information Service. And these two beautiful women today are also from the same team of Cancer Information Service. So would you like to take the honor to introduce yourself first before we move forward?
Thank you so much and a good day. Thank you for giving opportunity to introduce myself. My name is Kamala. I'm a part of CIS team.
Thank you, Atika and Kamala, for inviting me today. I'm Caroline, or you can call me Kaisin as well. I've worked in Cancer Information Service team for about 2 years.
Yeah. Thank you so much for taking the time today to join us in today's episodes of the Cancer Files. So before we move forward, I would just like to tell you guys that today's episode is about Cancer Information Service. Basically, we're going to dive deeper on what is CIS and also what really happens beyond the calls itself. So before we move on, let's just do like a quick questions to break the ice. So can you guys just first tell me about like what is your role in Cancer Information Service? Because like some people, they might not even know about what is CIS exactly. So what is your role basically? What do you do in a day-to-day as a CIS personnel?
Thank you for the question. Yeah, this is very important to let the public to know, because the terms of Cancer Information Service is very broad, and then it seems like a bit vague if we didn't really explain it clearly. So basically, Cancer Information Service team is actually also as known as Cancer Helpline, which we actually receive calls from the public or general public, or actually cancer survivors or patients or caregiver as well. So we are act as like a first point of contact for the public to know about what is related to cancer, any question about cancer. We also receive calls like basically asking about cancer screenings, like mammogram check, clinic related check, and as well as we also call out towards those cancer suspected cases that comes from our clinic team, which if they are being flagged as let's say for example a mammogram test that a patient have take, and then they got flagged as Barrett's maybe have some suspicious lump inside their breast, then basically we'll call up them to encourage them to seek further check-up, for encouraging them to be having this health-seeking behavior to increase their awareness of themselves, of their health as well. So maybe Kamala, you can try to add on.
Actually, I want to add a bit. Actually, our role is we are creating a base on information. What's the cancer and public to know lah. Actually, like who needs like family members, caregivers, the difficult time. So we need to provide the referrals to them, the emotional supports based on what their need.
Yeah, they really give you guys all very comprehensive informations on, and also explanations on what is CIS, or also known as Cancer Helplines basically. So what I like about what Kaisin said is that we are actually the first contact point of everyone. So if you actually even like if you feel like your questions is very small, you can still come to us, and then like we'll bridge you to the relevant teams lah, or even like we also provide you clarity and also more information. And Kamala also mentions that this what do we call, like if you want to get information, it's not limited to only patients, cancer patients, but even like general public, sometimes they just want to get clarity, and also they just want explanations on maybe cancer myth. Even though you're not diagnosed with cancer, you can also come to us and get the clear explanations. So also, like I would just now, Kaisen, you mentioned that you're here for almost 2 years, right? And Kamala, you're almost reaching 1 year.
One year,
And then for me, I just recently reached 1 year. So basically, I'm really interested to know like what exactly like drew you guys to this kind of work, because our work like really, what do you call it, very patient centered, and then like you work closely with the patients, caregivers, family members. So what exactly like motivates you to be in this part of the job?
Actually, being part of this this service give like empower the people who like with knowledge and emotional support, give the strong sense lah for the public and difficult times they want to survive. Still like most of the people don't know about the services what we are providing here.
Okay. So from what I understand, like you would want to give more exposure,
Yes.
and like want more people to be aware of
It's
like
the most
this kind.
challenges.
Okay. So you want people like to feel supported, is it?
Yes.
That's a very nice motivation.
Yeah.
Okay, what about you, Kaisen?
Yeah, on top of Kamala, I also actually quite similar like what Kamala have mentioned just now, that drew me into this job is the reason of actually I wanted to be aligned with my own personal mission lah, of actually provide a patient-centric, is like a person-centered care, as in a compassionate kind of care, rather than because clinical information, all this related towards the medical information is require professionalism. So aside from that, I wanted to actually provide more like a human-centric care, in terms of this job actually can let me to interact with patients hand to hand and support them emotionally as also like physically. You can try to actually interact with them and to really listen to them and care for the vulnerable communities, I could say. So this is a very meaningful job that I can actually contribute to the society and make life meaning quite differently lah, basically.
So you would want to
Quite
give like
unique experience.
you really like to work in a job where you can provide like meaningful contributions to the society or even like vulnerable communities. Okay, I would also like to share with you guys why exactly like I joined in this kind of what do you call positions. Is because like I feel when I first started, I was like in a very different what do you call background. I wasn't in the psychology or like the like this kind of background lah. But like I always feel like I'm gravitated towards helping people. But like you know like you can have a lot of patience, but patience alone doesn't what do we call like keeps you motivated. So for me like you need to have the willingness apart aside from the patience that you have to help people, you also need to have a willingness to help people. So because of this mindset, I've decided that maybe like I'm more suitable, like because I have the willingness to help people and then like go out of the way to help people as well.
Okay.
Yeah, so basically I feel like because all three of us have this kind of mindset, that's why like we come
are
into
here.
a team together.
Yes.
That's
Be
great.
together.
Yeah, that's great to know. Okay, so basically just now you guys have mentioned to me about like why you were joining in this kind of positions, and then you also give like a very comprehensive what do we call explanations about cancer information service itself. So for now, like can I know like what exactly happens during call? So for example, when patients or even the general public calls us at 1-800-881-1000, what usually happens during the calls? Do you want to go first, Kaishins?
Okay. Yeah. So thank you very much for the question. Basically, going back to that is like most of the callers, enquirers call in, they actually have a clear mindset of actually what they want, which is like basically like what I've mentioned is like if they call in for any donation related matter or any like clinic appointment related matter, then we can just directly transfer them or provide them the relevant team information. But aside from that, we also have like some callers that are recently getting diagnosed, patient that call in that require a little bit more of the emotional support that Kamala previously mentioned. So in terms of the service that we provided is also listening, active listening to them, informational support and also emotional support. So it's very depending on their situation, but we will always hold the space and step back with them first to actually assess their condition and understand more on what they're facing first before we give out any solution or any conclusion to that.
Okay, what about Kamala? What do you think usually happens like after?
Usually, the caller, the first time they call hers, it will become a blur. They don't know what to do. For example, like they don't understand what doctor said in the hospital, what's the next step, what they should to do, and like they did not get the clarification. So after they find us, they come to us, I think they will happy lah. They know what the next procedures and what's the next steps.
Yeah, that's true. So actually, like, what do you guys think? Like, when people calls you, do you usually think that they already know what they want, or sometimes they will call you and then they also, like what you mentioned, say feel blur and then they don't know what they want?
Actually, they know what they want, but the clarification is something missing there. They don't know how to proceed the steps. Actually, they know, but they like sometimes we are emotional. We don't know how to bring our track right. So we know the answer, but we don't know because because the cancer is a very emotional. They will kill our emotional right.
True.
So that's why they always find hers to know the better way to bring either patient or caregiver for their family members lah.
True, because sometimes I also receive the calls where patients at first they will just ask about the very tangible support, like, oh, do you have any financial assistance? Do you have like monetary aids or something? And then like, but when we talk to them more, and then we discover that they actually also require emotional support, and then like they're not emotionally stable, and then like when you dive like more deeply, then you also figure out that it's not just them like who are also struggling emotionally, like their family members, their very loved one and close one are also like struggling with this kind of things as well.
Just to also on top of what Atika and Kamala have mentioned, just an add-on. So basically, when they call in terms of like the sense of miserable that Kamala was pointing out, is actually they are not that they don't know what they want, but it's like if they call in, then we can actually guide them one by one step, because of cancer is sometimes being diagnosed in a very sudden situation. So we doesn't have the time to actually digest emotionally in terms of this cancer suddenly appears in our life, right? So this is very common that we actually hold back, take a step back to hold space with them and provide them the emotional support first. So in terms of that, then we can gain more clarity on that, and also we can provide the clarification lah, in terms of any medical terms if they are not sure about what the doctor is saying, and also in terms of if on top of that is more like basically the healthcare system that they also not really clear about, then we can explain more on that as well. So I think the main point is I wanted to explain more on the emotional part lah, that actually can help to clear out what they are actually receiving from the doctor, and we are able to listen more attentively in order to find out whether is it the question that they're asking at first, like what Atika have mentioned, like is it really financial support that they are looking, or is it when we are able to stay with them by the question and ask them and understand more on the situation? Then I got a case that is quite similar, like what Atika mentioned, is like they are seeking for financial support at first, but after I've dived in, like what Atika mentioned, like we can actually support them emotionally. Afterwards, I first realized that they also have some problem on the transportation, because of going towards the hospital is quite far within their living area lah. Let's say it's like Pahang, they're staying, and then they need to come towards KL to receive the treatment. So they also require transportation and accommodation care, which maybe they require the cancer treatment in the hospital, to do radiotherapy every day. So that part, then we can also provide like more tangible support in terms of that as well. So this is like the importance of we are able to listen more attentively, active listening, the reason behind. So we are not only supporting them in terms of technical or any intangible support, but also to support them in a more holistic way.
True. So basically, like even when someone call us, inquire us with one thing, we cannot just immediately assume that they only need that one kind of supports.
Yes.
We try to listen more and then like get more information out of them to be able to also understand their where they stand on during their life, and then what other supports that they need also. Let's say if someone calls you, like what Kaisin says, they're asking for like vehicles, transportation. But then like when you talk more with them, and then you discover that they also need other kind of support as well emotionally, and probably maybe they would require support group as well, right? So can we all agree that actually like, our job is not just like information support, information-based supports, but we do also provide emotional based support as well.
Yes.
But just like for clarifications, guys, like the emotional support that we do give to patients are like on a very surface level, since that we don't have any clinical psychology what we call background. So for that one, like when the patients require like further emotional support, we definitely refer them to the mental health team lah. Okay, so before we proceed, I have a quick game for you guys. So it's called Two Truth and One Lie. So basically just now that we've talked a bit about like what is cancer information service, and then we also get to know our own CIS personnel as well. And so in this game, I will give you guys like 3 statements where I have encountered with my patients. However, in these 3 statements, there is one lie. So you have to guess which one is the lie and which one is the truth of the statements. So are you guys ready about this? Are you guys clear?
Yes.
Let's go.
Okay, so the first statement is someone had asked me before whether eating a chicken that has been injected, yang kena cocok tu kan, can cause cancer. Okay, that's the first statement. Second statement, someone told me before that she might got cancer because of bad karma and also the past sins that she probably has committed. And then the third one is someone had asked me if cancer screening is painful and can cause side effects, prolonged side effects. So you guys can discuss with each other and guess like which one is the lie. What do you think, Kamala?
For me, number 1 and number 3 is true, and then number 2 is false lah.
Why do you think number 2 is the lie?
Don't know. Basically, I don't believe that is she or he said like it's a bad because of karma. I'm not sure about that, so I think that one is false lah.
Okay, so the number 1 and number 3, have you encountered something similar like the number 1 and 3?
Any enquirers ask you about something like this?
No, but like it's very what do we call convincible, is it?
Very convincible.
What about you, Kaishin? What do you think?
Actually, quite similar like what Kabbalah is thinking.
But
actually, 3 of them, the statement also I've encountered before. Like they are like inquirers that's really asking me all 3 of these questions. It's just very not too convincing for the second statement as well, because I think only just maybe very less call lah. That most frequent call that I receive is like the first statement. They actually very afraid about like those food, maybe microwave or injected hormones, protein or the last statement is very common as well that we've received. So it's very important for us to actually clarify that the statement as well. So the second one, I think only maybe 1 or 2 callers that they've really talked something about this, but it's not like a bad karma thing that they mentioned. It's more like they think that they are unfortunate in their life. So yeah, it's actually quite tricky, this question.
So you
but very fun to play that.
1 and 3 lah.
I'll stand with Kabbalah's idea.
But all these 3 statements, right, it's very, what do we call, very likely for us to receive this kind of inquiry, right?
Exactly.
Because like every day when we receive calls or inquiry from people out there, like you have to expect everything. Sometimes like they will just come to you with a very random inquiry, right?
Yeah.
Okay, so you guys want to know which one is the lie?
Yeah, of
Yes.
course.
Okay.
Is it number 2? Basically, it's number 2.
There's any present for us?
No present, unfortunately.
Okay.
So
Prize.
the lie is actually number 1.
Oh.
Oh, wow.
Yeah.
Okay.
So I've never
very-
received yet, but however, I will still like leave it open because someone might ask this kind of questions to me.
Yeah,
But I
received
do receive
before already.
like number 2 and number 3 statement. Like I received someone like who did ask me about this. Number 2, this caller who was just calling me, and then like she just wanted someone to talk to lah. And then at that time like she was crying, and then she said that, oh, is it because like I got this cancer because of the wrongdoings that I did in my previous years, and then is this like a way of God wants to punish her and all. So from there on, I have to reassure her that this is not like a bad karma or something. Probably this is just a test for you, and then maybe something better is coming your way, right?
Yeah.
So have you guys like encountered like any very, what do we call, very macam out of the norms kind of statements from the inquirer?
Out of the norm.
So far, no.
Still normal.
Still normal.
What about you, Kaisi?
Yeah, I think only one, if I'm not mistaken, is related towards the wine.
I remember this one.
Yeah. Basically, the caller is asking me whether drinking wine can actually cure cancer. So this is also it's like not very out of norm, but it's just quite random.
Very surprising. I think like you also received like one inquirer like who asked like, someone is selling me this special water, and then the water cost me like, what was it, like 1,000 ringgit or something just for a water. And then like you have to like explain to them like this is not like there's no it's not credible or like not proven by doctors lah, kind of something.
I think it's like just to add on that, I think it's more like an energized water that in the market is most probably like direct selling kind of marketing technique that they put there is like anti-cancer proven kind of the claims. Then I think it's very careful. We need to be very careful in in this kind of claims that they have made with the product. So it's better that you can call up us and then we can actually refer you towards our dietitian to have the professional say on this, because we never know. Like I remember the patient getting the feedback from there is like, I think she tried to drink it and then she feels good after she drinks it. Then she wants to continue it, and then after that she just wanted to find more towards like financial support that can we help her to buy this kind of product. Then I was like, yeah, I provide like clarification to her. It's like just need to double check with your doctors and your medical team related to this kind of claims. Is it really reliable or not? Like you feeling good, is it because of you also do something else in terms of maybe you have some lifestyle changes you started to take care more on yourself, sleeping schedule better it's like so many kind of factors that it will affect your physical changes in your body as well.
True. Since like we're the first contact point of the patients, like so sometimes that patients will come to us with a very absurd and like very what we call every kind of questions that they will come to us. But since like we will usually like, let's say if patients ask us about medications or like something about like a very specific kind of questions, so we will usually refer them to the correct or relevant teams if they ask about dietary intakes and all. So usually we'll get information for them and then we'll forward this information to the dietitians, to the relevant team if you want to refer them to the dietitians. So if we want to refer patients to our doctors, then usually we'll ask them a few of their medical history, the medical history lah, and then like we'll forward all these details to the doctors for them to explain more. So for us, it's like usually the first contact points, and then we get all the surface level information out of them. Right?
Exactly.
Okay, so like since we're talking about like any what we call encounters or like questions that we receive from the enquirer, like do you guys want to share about any specific headline stories, CIS stories that you like that we what we call that have made impact in our life? Has there been any enquiry or calls or even like encounters that you have had with patients before that has left an impact in your life? So let's say you receive this call and then it has been with you for a few days or a few weeks. Is there any moment of that?
Actually, I have one case in recently by last week. There is a sister call for her sister. She need some support guide. Actually, the story is a sister or 2 times is a miscarriage, and then 3rd time he give a birth, and then that time doctor mentions there's something grow into your uterus, and then doctor said that no need to remove or operate anything lah. But after the give birth, the patient like almost like 3 months or 3 to 6 months, he feel like weight gain, something he can feel some difference in the body lah. And then he family bring her to the hospital to did blood test, everything. Then the hospital suggested that she have a fibroid in the uterus. For unluckily, after a family discussion, she went for the second opinion in the different hospital. She find out that that's not like a fibroid or it's a cancer in the uterus. So immediately within I think 3 days, he need to remove a uterus because it's going to be effect in the lungs. So I feel so sad because of the baby is new. She need to enjoy the mommy's movement, but now she's troubling to in the cancer survivor. Then she yesterday I spoke with the patients, like she looking for, she said like private hospital doctors said different, then government hospital doctors said different, and I Google it, it's a different. So I don't know which one I need to follow up. So I need some peer support or dietitian for nutrition because I need to feed my baby also. But I feel so sad lah.
Then how did you overcome that difficult calls?
Yeah.
I said myself, it won't be happen in my life or in my family members lah. I pray for her lah to become to recovery very soon.
True. Because like this, what you call this kind
Something
of calls
spiritual.
can be like very difficult and leave an impact in CIS
Alive.
personnel as well. Because like this one, like the patients are already like discovered that she got diagnosed with cancer, and then on top of that, she has to care for her babies as well, right?
Yes.
And then what do you call, like when you got this kind of call, you realize that it's not just one thing that they have to struggle with.
Yeah.
Yes.
There's also like a few things surrounding them that are also adding up to their struggles on top of the cancer.
Yeah.
And then like from there on, like you also you feel very macam motivated
Empathetic.
because like because they got diagnosed with cancer, but then they still are strong enough to overcome this cancer and also get through the days because of the babies, and then it shows like how strong and resilient the patients can be lah.
Yes.
Exactly.
What about you, Kaishins? Any scenarios or encounters that you face with patients that has left a very impact in your
Yep.
life? as well?
Yeah, actually, it's quite, I think, similar like Kamala's, just that it's more towards that I've realized a cancer diagnosis can actually also leave a positive effect in terms of the families that I've actually encountered before. Like, actually, I've encountered a lot of cases that leave like lessons that I can learn through the scenarios and through the cases that I've handled. But the most recent case that I could remember that is quite also highlighting that actually cancer diagnosis can not only just will be affecting a person negatively, but also it can be a positive shift in terms of increasing the relationship within the patients and the caregiver as well. So this case is about like a patient that have a breast cancer survivor's condition that she actually called in and she was quite worried about her son that is in overseas, which is the distance that causing them to actually cannot really get support immediately with her son as well. So she's quite worried, and then she's like also worried on whether is it good to reveal her diagnosis towards her son. So it's like this kind of anxious state and worried state. But she still decided because it's not like covering up is not really good, bottling up with her own feelings also. So she still decided to reveal this towards her son. Eventually, her son is actually an academic achievers. It's like high achievers lah. So, but in terms of that, after he knows about her mother condition, his grade is actually dropping quite not really well, performing well as previously he did. At last, he actually also willing to pick up my call because her mother actually called me to send regards to actually follow up on him and then also follow up on her mother's situation like this case. And basically I've actually just try to provide them emotional support and also refer them towards our mental health support. And at last, I think last week I've just followed up with her also. This case is about like maybe 2 weeks ago. So within this week, actually, it's a very good feedback that her mom and also the son telling me that because of this cancer diagnosis, I feel like I'm having more courage and to provide like more intimate relationship with my mom and also with her son as well. So they actually strengthen their relationship bond in that sense. So this really affects me in terms of I see that although cancer diagnosis is very sudden and sometimes it's like very in a loss situation that at first we will happen to be, but after we go it along the way and then we try to actually strive it and actually go through with it, it's actually not that bad in that sense that we can actually see something that it's actually improving, which maybe this is a chance for them to build on more trust and build on more love within their family as well. So how we actually respond towards the incident that we have faced is very important in that sense, that make a big difference lah. If we see the cancer as a very bad thing, then we will struggle it along. But if we can try to make a step back to actually think of, oh, maybe how can I cope with it? So changing the perspective of thinking how to actually deal with this problem, then this is maybe possible to become a positive impact in our life as well.
True. Instead of just what do we call like the stories of what do you call our encounter with our patients has also give like a very positive impact to ourselves as well. Because like for example, like a difference between us and also doctors, like doctors contributions to the patients is very direct. Like they do treatments for the patients, they give medications and like a very clinical advices. But for us, like our probably our contributions to the patients is not very direct. It can be very subtle, and like how we make impact in our patient's life is also very subtle. Like for example, like how Kashin's mentioned just now, like you have reconnect the patients and also her loved one, or which are the son, right? The son to reconnect and rediscover their relationships again. Also, like I would also like to share one encounters that I have with my patients. Very simple one. It's like for my patients, is one I met them she was a walk-in patient. So I met her personally face to face, and then at that time she was very anxious because she just got diagnosed with breast cancer stage 3A, and then it's like there's a lot of emotions at the moment, and then she was overwhelmed. So when I met her, she was like, oh, take this, take that, take all these documents and help me. And then at that time, like when I talked to her, I calmed her down, and then she digests her emotions better. And then the next time I met her, she joined one of the support group activities, which are the laughter therapy. And then like she came to me and she was like, oh, thank you so much, Atika, for referring me to this support group activities. And then I asked her how was it, and then she said she joined the laughter therapy, and then like the therapist at that time, she was just a girl, a disabled girl who was on a chair, and then she was the one like who conducted this laughter therapy. And then she said that when I saw her, I felt that my problem is very small, because like someone like who had it like probably worse than me, like who are not able to walk, can still conduct like a therapy sessions to encourage people to be more appreciative and more grateful, and then to be more positive in their life. And then what else can I be complain more lah. So like from there on, like when I heard her say that like how her emotions has significantly improved for the better, I feel like macam you rasa satisfaction where I also like need to be more grateful, and then like probably I'm here to help these people, and then like when you're able to help them, you feel happy lah, and then more grateful, right? Okay, so moving on to the next part. I don't know like whether you guys have noticed it or not, but in our team here, we have kita satu Malaysia. So we
To
have
Malaysia.
a Malay here, and then like we have a Chinese and also Indian. So we have all representative. So basically, as we know that in Malaysia, we are a multicultural country, right? And then like all people like speak a lot of languages, not just Malay, Chinese, and also Indian. Some also speak other dialect as well, different dialect and also like different kind of languages. So our cancer helpline, cancer information service, we do provide our support in different kind of languages. So like when you call us, you are able to pick languages in these 3 languages, including English as well, and we will cater your enquiry based on your languages chosen. So what do you guys think? Does language play a very important role in our cancer information service?
Actually, yes, it's a very important because the language bring us more clarity and happy moment for the patient. For example, I have a patient, a wife call because of behalf of want to ask something about husband. First the call, he like mentioned a bit like something that's a gap when he mentioned that.
Words by words.
Then I identify that she's something want to explain the language problem. So I just asking, can I speak with your mother tongue? Then she say can. Then immediately I change the mother tongue. She also immediately changed the happiness to share everything immediately. Then I understand that there's the language problem with us. Even though face to face or phone call also, the language is the most important.
So like the patients are becoming more open and
Yes,
comfortable to talk to you.
yes, open-minded lah.
What about you, Kaishin? What do you think?
Yep. It's really also like what on top of what both of you have mentioned is like language provide a sense of trust and also comfortability to lower down the defensive barrier. Because of the language barrier, then we cannot really understand what the caller is actually asking, and also what we should be able to provide clarification on. Does they really understand? If they didn't like speak in the language they can really understand, that kind of situation. So on top of that, it's just adding on point that our cancer helpline actually provides English, Malay, Chinese, and also Tamil. So this is the 4 language that we can cover, multicultural and multi-language in our helpline. This is like to build up the rapport is also more easier. So increase our trust towards the patient and also the trust towards us as well, patient towards us. So I think this is very important also to let the audience and the inquirers to have their preference of language to pick up and also to call in to us as well. So actually supporting through different racial and different cultural kind of aspect in Malaysia is very essential to provide more holistic care, to break down the language barrier within different different ethnicity. So it's also a sense of mutual respect that can build up in our association.
True. It's good that you mentioned that what do we call it, languages also helps to build rapport and also create trust in the inquirer, because sometimes they come to you, they have the inquiry, but they're not comfortable, and then they don't know how to find the right words of their inquiry. So when they pick a language that they are comfortable in, they're more the rapport will be built, and then they're more willing to share and comfortable to explain to you about the questions that they have.
Yes.
So when we're talking about language itself, so I'm just gonna test you guys of how well our CIS personnel is gonna communicate, since like languages also requires communications skills.
Okay.
So we're gonna do like a very quick games where we're gonna play. It's called taboo game, taboo words game. So I'm gonna give Kamala and Kaishin says gonna be words, and then you have to explain. So like if I give you Kaishin's the word, and then you have to explain to Kamala without using the taboo words that are mentioned there. And then like Kamala, you have to guess what are the words that Kaishin's are trying to explain to you.
And with some kind of restriction word, is it? Or something like that?
Yes. So there are taboo words down there, so you can't use this word. So let's say if I pick the words is
Cancer.
Cancer. So the words, the taboo words that are being mentioned are probably disease or NCD and then something. So that one you can't use that kind of words to explain. Okay. So probably who wants to start first?
Want to start first? Okay. Okay. I'll be guessing Kamala's taboo word. Okay.
Oh my god.
I'll pick.
Okay.
Okay.
Ready?
Okay.
Make sure you don't use the taboo words, okay?
That's the difficult part.
Okay, so our audiences who are also listening and watching, you guys can also try to guess this word as well.
Yep.
Okay.
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 I guess first, huh? Support.
No. You have to explain. The word is up there.
Uh-huh.
And you have to explain to Kaishin. Kaishin is
The
the
one
one
that
that will
gets
have to
it.
guess the words.
Oh, okay.
A kind of support that you mentioned?
No. Okay. No. Okay. Can I use any other name, right? People name, right? Like
People name.
In the
I
department?
think probably not use the people's name since our audiences might not know who we are talking about. Okay, so you have to use a very general words.
Okay. Take your time.
Is it too hard for you or like Kaishin, do you want to start first?
Kaishin lah.
Okay,
I
Kaishin
see
first.
this. Okay, sure. See ya. Wow, okay. I mean, like, if in another languages?
You can use Malay as well.
Okay. Then I can use Malay to explain this.
But make sure the Malay words that you use is not translations of the taboo words, okay?
Wow.
It's too difficult.
This is a bit hard. I mean,
We're gonna test your communication skills, guys.
okay. How to say that? If is okay, it's a check, body check.
Body check.
Downstairs we have it. Clinic. It's very common. People calling out and ask it.
Mammogram.
Yes. Oh my god, this is good. We have some kind of chemistry
That
within
just
the
shows
team.
how well our CIS personnel can communicate and convey the information to our audience. Okay, Kamala's turn.
Pink Unity.
Women Cancer Support Group.
No.
Shorter. Support group.
No.
Group. Support. Resource Wellness Center. Is it correct?
No.
Okay, let me think.
Who run the Pink Unity?
Puan Mahani?
Who is she?
A peer support coordinator.
No.
Okay, you guys can also try to guess. This
Okay.
You want me to help you? Okay. She's getting there. So the people in the Pink Unity group or any kind of support groups who comes together. Why do they come together? Because
Who they?
who are they?
Cancer survivors.
Yeah.
Oh, okay. Wow, this is hard. Okay.
Finally.
Oh,
Finally, we got the two answers correct.
Okay.
So yeah, so this game is just
So
to show
good.
that since our job as a cancer information service personnel, so we requires a lot of communication skills, and then so we also requires active listening skills. Just now in the games, like when Kamala is giving trying to explain about the words, and Kaishit have to actively listening to the explanations to get like, what is she trying to convey. So this also applies when we do our day-to-day job as a CIS personnel, where one patient mentions one information, so we can't just take that information. We also will try to actively listen to them, and then what are the behind what do they want to try to convey to us, not just the very direct information. They are also trying to get help in other kind of sense that we need to explore them more. Alright, okay. Yes. So to move forward, we have a few questions left in our last part of our podcast today. So basically, can you guys just tell why, let's say if someone's got diagnosed with cancer, not just got diagnosed, maybe someone they know got diagnosed with cancer, and then they're not very sure about who they need to reach out to, and then do I have to call this cancer information service? Are they very trusted or not? And then like what would you say to them, or what kind of advice you would want to give to them to say to them that it's okay to call us, it's okay to reach out to us. So what kind of advice would you give to them?
So to start on that, it's like also it's very important to let them to know that it's a very safe helpline, because our helpline is basically although it's like being recorded, but all information is private and confidential, so we cannot leak out all any kind of information that based on our callers have shared with us. Just in order to we need to get the consent of the patient. If let's say that we have a friend that are calling from basically to ask about her friend's cancer diagnosis situation. So before that, we will actually, if the friend is asking about, can I actually share you more about like my friend's details, and then please also call up her to let her to know that you guys can actually provide her this kind of support. Then before that, actually we need to get the consent of the friend that actually have already informed the patient that we will be calling out them, because of this is also the consent part. We respect the patient to see like whether is it okay for us to reach out to them, the comfortability and the rapport part to build up, in the sense of to build up the trust that we can with the patient as well. So we just need to be a little bit more careful on here. But aside from that, if any question, it's like what I think Kamala and Atika have mentioned about, like random question or any small question, basically you can always call in, as long as is related to cancer, then we are very happy to help out as well. So what I'll say to the callers, that if they're quite worried or they're quite unsure of what to call, actually anything that are very small, it's as long as it's matter or really concerning or worrying to you, then it's an important question to actually let us to help on, and we can actually hold you step by step. We make it step by step together to see what we can explore and what we can actually help you out on that. So it's important to let them to have a space for them, and also important to let us to access and understand the reason behind that they call as well. So this is what I think I'll say.
Yeah, true. Like from what Kaishin said, it's like every question is still a question. So even when you feel that questions is very trivial, very small matters, you can still come to us, and then we'll try to provide like a safe space for you to feel comfortable to ask any kind of questions, and we'll try to be our best to guide and support you. Okay, what about Kamala? Yeah.
It's always better to ask than we said worried lah. no question it's a big or small, what Kaishin say about the symptoms or screening, diet, what counseling, just call and ask us. Then we're ready to help you and guide you.
True. Is there a right moment to call?
Yeah, tricky question.
Right moment, what you mean by as a...
I mean, okay, to answer Atika's question, our helpline have an operation hour is like basically from Monday to Friday, 8:30 a.m. to 4:30 p.m. If Saturday will be on 8:30 a.m. To 1:30 p.m. I mean, it doesn't really have right timing. If you said an ideal time will be this operation hour lah. But if it's the right timing for the patient to call us, it's just a reference. Basically, is when they got diagnosed very recently, like just on today, if you got diagnosed, actually, if you are really very worried, and you didn't like really have anyone that can support you within along to the hospital appointment or any treatment, you really have many doubts, you can definitely call up our 1-800 number, 881,000 immediately. So we will actually, although we are not operating 24 hours, but we also will pick up the calls from the previous days, and we will directly get the immediate call out to reach out towards the callers from the missed call logs.
Yep. True. Yeah. So even though we have our operating hours, but there's no right time to pause lah. Whenever you feel like even though like you already in the last stage of cancer, and then you can still call us, and then like even like to seek comfort and just to find connections, we are always there to help you lah in your cancer journey. Yeah. So anyway, thank you to Kamala and also thank you to Kashins for joining us in today's episode. So any final say? Just probably just 3 sentences to share. What do you guys feel working as a cancer information service personnel for the past 2 years and also for the past almost 1 year time?
Actually, thank you so much. And then I feel so happy to be here, and I'm still I'm still learning. Even though it's 1 year, it's still learning because it's different from different. So don't wait until the end. Just call us. We are waiting for you to help.
Yes. We are waiting.
Well said. Yeah. So really appreciate any interaction that I have with patient and also with caller, any enquiries, any question that I receive. I'm really grateful that I can really learn a lot throughout this 2 years experience, and we are really ready. So just like we have concluded this session, is any question is not a dumb question. So please call in if you have really are feeling lost or any miserable question. You have any question about cancer, we are always welcome. So just call in our 1-800 881,000 number. Yep.
Okay, thank you to Kamala and Kaishins for joining us in the today's episodes of the Cancer Files. So yeah, and behind every call there are always someone who are trying to digest this difficult times of their life, and we are here definitely to provide you a very safe space for you to share and find comfort, or even like to find connections. And even if you are unsure to call and to find like who to reach out to, we are always here, and all you need is help, and we are here to provide the help. So you can always call us at 1-800 881,000 or leave us an email at help@cancer.org.my, and then we're all 3 of us will be here to support you and guide you in your cancer journey together. So see you guys again in the next episode. Until then, bye.
Bye.